Hello everyone, Assalamu alaikum. Welcome back to Dr. Teeth, or in case if you're new here, welcome to Dr. Teeth. I am Dr. Hina, a dentist by profession, and on this platform I try my best to share good dental information with all my viewers. So if you're new here, please consider subscribing. Now today we are going to talk about bleeding gums. What causes bleeding gums and how can we treat bleeding gums at home? So even though I'm a dentist and I would like you to visit me, but still I'm going to tell you some of the most effective ways by which you can treat your bleeding gums at home and you would not need to visit somebody like me. Alright, so let's see what causes bleeding gums first. Now there can be several reasons. First of them, and very common, is trauma. If you brush very vigorously, you can have toothbrush trauma. While eating, there can be impaction of certain sharp pieces in your gums. That can also cause bleeding. Taking too hot food can also lead to trauma to the gingiva. One of the most common cause is chronic inflammation because of the plaque accumulation. If you don't brush properly, there will be plaque accumulation that will be converted to calculus and that will lead to bleeding gums. There are various other reasons also that can lead to bleeding gums, such as deficiency of vitamin C, vitamin K, certain platelet disorders like thrombocytopenic purpura, coagulation defects, in that the blood doesn't form clots properly. Such conditions are hemophilia, leukemia. So in all these conditions, there can be bleeding gums. Also, taking some drugs very excessively like salicylates, anticoagulants can also lead to bleeding gums. So these are some of the main factors that can lead to bleeding gums, and very common is the inflammation of the gums because of plaque and calculus. Okay, so now we know some of the main causes of bleeding gums, right? But why does the gum bleed? What is happening internally that is causing the blood to come out from there? So whenever you have inflammation of the gums because of plaque, calculus, what happens is this is the epithelium of your gums, okay? So it has various parts. Now this part right here, this is the sulcular epithelium because this is the sulcus. Sulcus means the pocket. I'm just telling you in the layman's terms so that you can understand if you are general public other than the dental students I have on my platform, right? So this right here, this lining of this pocket, that is the sulcular epithelium. So when this epithelium gets thinned out because of the plaque, because of the bacteria, toxic substances, right? So we have thin epithelium, and below the epithelium we have this tissue, connective tissue. And in the connective tissue, we had small blood vessels, very small blood vessels. They are known as capillaries. Now, the capillaries, they will dilate. They will increase in size. And the blood inside, they will, accumulate. Now, since the capillaries, they dilate, they kind of swell up. And also the epithelium is quite thin now because of the inflammation. The chances of rupturing of these capillaries is more. So that is why the gingiva is more prone to bleeding. And that is why when you go to the dentist, they have an instrument. This is a periodontal probe. And we take this instrument and we check your pocket to see if there is bleeding. Now, without wasting any more time, let's see some of the best home remedies that you can do to prevent the bleeding gums. First of all, we have to maintain proper oral hygiene. Brush properly, floss properly. Here, few things we need to keep in mind. I already have a video on my channel on the brushing technique, but in short, I'll just tell you that you don't have to brush horizontally, you have to brush up and down. You don't have to apply a lot of pressure. You don't have to use a toothbrush that is having very hard bristles, and you don't have to brush very vigorously. So brushing technique is important, and also brushing frequency is important. You have to brush twice daily, once after getting up and once before sleeping. Then flossing, obviously flossing is very important no matter how well you brush your teeth. In between the teeth, your bristles are not able to go. They are not able to clean there. That is why flossing is very important. Then second, gargle with betadine. Take betadine, dilute it, and then gargle it. This will help you with the inflammation. You can also take little warm water, add salt to it and gargle with it. This will also subside the inflammation and improve your condition. The bleeding will lessen. You can take equal quantities of baking soda and salt. Take them on your brush and brush with it. It also helps. Honey is natural antiseptic. You can take honey and massage your gums. Then increase the intake of vitamin C and vitamin K. And if your condition is chronic and you're not seeing any significant improvement, you might need a professional cleaning done by your dentist. That is called as scaling. Some medicines will be given to you after scaling, and that will really help in subsiding this problem. Now, if you are not seeing any improvement with all the home remedies and by scaling also, rule out the cause. As we have seen in the starting of this video that there could be many causes of bleeding gum. You can have systemic diseases, God forbid. Pregnant women have a lot of hormonal changes that can also aggravate this condition. During the menstrual cycle, the prevalence of gingivitis increases. So there are many factors, and all these things, they have to be ruled out to see what the real cause is, and the treatment has to be done likewise. So I hope you found the video helpful, and if you did, do let me know in the comment section below about what topic should I cover next. And if you have any questions, you can also let me know in the comment section below. I will try my best to reply you as soon as possible. I'll see you in the next video. Take care. Allah Hafiz.